So hi there, IOSH Chiltern members. It's Greg Dearsly here from NZISM in New Zealand. Just following up on some questions from the webinar that we did earlier this week, and there were some questions that we didn't get to, and been provided those questions and happy to provide some commentary on them. So the first question was, what do we think the long-term outlook is regarding COVID-19? If a vaccine is not discovered or effective, how do we return to normal? I think that's an interesting one, and maybe I won't sort of talk about some of those comments directly, but there's been lots of talk about and use of the word unprecedented, and this whole situation being an unprecedented one. I'm not sure, is it? Maybe our response has been unprecedented. But a flu of this nature, I'm not sure it's as unprecedented as it's made out to be. This certainly won't be the last time it occurs, and I think I pointed that out the other day. My next point is what is normal, and will we ever return to it? Whatever we do to respond will become the new normal. Things like increased focus on hygiene, more flexible working arrangements, a couple of things that we might see as being normal. As an example of that, one of the biggest insurance companies in New Zealand has announced that 75% of its staff will work from home permanently. Face-to-face globalisation probably won't be a reality for some time yet, and you might think that that's maybe a definition of normal. And I certainly think that this experience will fast track our online capability. So, I think whatever we do to move forward from this situation will become our new normal. What we did in the past, maybe we won't do some of those things. So maybe we won't return to normal. We'll just do things differently. And again, as I said the other day, disaster is the mother of opportunity, and the opportunity to change the way that we do some things. So the next question, well, it's not a question really, it's a comment, I think, and it goes, our President, Andrew, and many others will be happy to hear the term physical distancing instead of social distancing. Well done. The UK government, it's not too late to change, and U-turns seem to be popular, and if maybe I'll just comment on that briefly. We did start out using that term social distancing. But as was pointed out by somebody during the presentation, actually, we didn't stop being social. In a lot of cases, I think we got more social with the online technology capabilities we had. And certainly what I observed during lockdown was we would go for walks around our local area. And as you approach somebody coming the other way, certainly the physical distancing protocols were observed, and people would spread out and walk on the road or the grass verge or whatever. But we would acknowledge one another as we walked past. I think historically, if that situation was to occur, we probably didn't acknowledge one another because we had our nose buried in our telephone. So actually, I think, the physical distancing is the right term, and social distancing is probably not an accurate reflection of what we really want to be doing. The next question is, how critical or influential is density of population in affecting the overall rate of infection? And regional differences suggest that different levels of control are needed. And yeah, absolutely, there is no doubt that some rural areas were at less risk, and some of our data does show this. However, and again, I mentioned this the other day, it was a team effort and everyone had to follow the same rules. We did have discussions about the possibility of certain regions having more relaxed rules as we came out of the alert levels, but that never actually eventuated. And I think the ease of travel around the country meant that the risk could pop up anywhere at any time. And as an example of that, Gore, the town of Gore, which is a very small town in the farthest tip of the South Island, and that ended up being the home to one of our biggest clusters of the infection. So just because we were in an area that might have meant we were potentially at less risk, it didn't actually mean that was reality. So hence the focus on the team of 5 million, and it was something that everybody had to take responsibility for. So the next question is about tourism, and the person has asked, tourism is obviously very important to New Zealand, and how did the government react mid-crisis when entry to the country was restricted, and what support did they get from the market? Yes, you're right, tourism was hit very hard, and the government has provided and made announcements along this lines about halfway through the last sort of lockdown period, that they were going to put into the budget multi-hundreds of millions of dollars of support for the tourism sector. They've gone and set up a tourism transitions program, and there is a tourism recovery ministers group with membership spanning across the Ministry of Tourism, the Ministry of Finance, Māori Development and Conservation. There's been a public and private task force set up to help shape the future of tourism in New Zealand, and that again consists of cross-government and tourism sector representatives. And really just a massive focus on advertising and promotion of domestic travel and tourism. And look, I think the public of New Zealand will benefit from that over the coming weeks and months. We've seen some pretty sharp pricing around accommodation and flights and events and those sorts of things as tourism operators just try and get some sort of lubrication into their sector. The next question is, how corrosive has the media been in obscuring the messages that were given? I guess I'd have to say the media really hasn't had the chance to obscure the messaging, because the messaging has been coming directly from the government and those that are running the program and the state of emergency situation. And as I said in the presentation, every day we had a live update freely available, delivered in the main by the Prime Minister and the Director of General of Health and other key officials at times. So we were getting the messages straight from government. Talked about that one source of truth concept. And these sessions were open to the media, so the media did have the opportunity to challenge what they were being told and ask questions, and they certainly did that. And look, no doubt there was lots of other media commentary in the social media environment and other areas which you might describe as being corrosive, but there was also always that option to get the message straight from the top on a daily basis. We tended to get the good and the bad news from these sessions, and believe me, there were a number of negative stories that came out where the government had to put their hand up and say that was wrong or that was something that shouldn't have happened. And so it wasn't just all good news that was being delivered. There was certainly those negative stories as well. The next question, has the alert level changed in New Zealand since yesterday? And I think what's been referred to as yesterday was the announcement of the 2 British visitors that tested positive after being let out of their quarantine situation for compassionate reasons. And the question goes on to say what is being done to contain this new outbreak. So look, even today, and I'm recording this 2 or 3 days after the webinar, the alert level remains at level 1. In terms of containment, all those who could have been in contact with the 2 individuals have been identified, and that number's basically everyone that was on the plane, which I think came in from Brisbane. And I think they've identified the number at around about 360 people. There seems to be 2 individuals who may have had direct contact with these 2 travellers, and they have been tested, and the last I heard, one of them had returned a negative result, and the other result was still to be announced. And it certainly has caused serious questions to be asked about the quality of the containment of international travellers. And I certainly don't think that we've heard the last of this story. The next question is a little bit construction focused, but so I'll answer it in 2 ways. But the question is the success of bubbles, the 2 metre physical distancing, face coverings, etc. How successful has that been on construction sites? I guess generally The concept of bubbles, I think, was a great success. Yes, there were people that didn't comply, and some actions of non-compliance actually became a criminal offence. And there were several hundred people that were actually charged with these breaches. The worst case was a bloke who walked around a supermarket coughing on people and saying that he was infected with COVID-19. Lucky old him, he's now in jail for 16 months. I think people did their best with the 2 metre rule. It was pretty hard in some environments like supermarkets, which was really the only place that you could go during the level 4 lockdown. So it was pretty tough to be wandering around a supermarket and trying to keep 2 metres away from everybody, although all of the supermarkets were managing the number of people that were allowed in at any one time. So there was sort of a check at the gate, if you like. In terms of other controls that have been put in place around the physical distancing, in our main city in Auckland here, the main street in the CBD has had all its footpaths widened to enable distancing to be easier to manage. In terms of face coverings, and I said this the other night, they were really never a thing that was hugely focused on. Yes, there was a focus, but that was for medical workers and healthcare workers and those that had maybe had the disease, and certainly those with who were classed as vulnerable people. Of course, many people did wear masks, but the focus was more on hygiene and surface contact. Not easy on a construction site. If we, just dive into the depth of that question a little bit more. But basically the message was, if you couldn't do a task without following what was originally the 2 metre rule, and as we came down it sort of was lessened to 1 metre, but if you couldn't comply with those requirements on a construction site, it was basically deemed that the task wasn't safe to be done in the way that it was planned to be done, and you'd have to come up with another approach. So those messages were coming not just from the government, but from within the construction sector as well. The organisations that were helping the construction industry companies with their COVID-19 control methods. The last question, a pretty broad one. How does New Zealand trace COVID? So in terms of tracking, this is all done via our district health boards under the management of the Ministry of Health. So cases are reportable to this agency, and then investigation into contact tracing is completed and those at risk are tested. There were public testing facilities set up, and actually that was interesting to see that was creating large queues of people that wanted to be tested. We thought our border controls were pretty good, but clearly that's maybe not a reflection of reality. And with contact tracing no longer formally required, it's really up to businesses and individuals to use the QR code tracing app when they visit places, and maybe also keep their own records. We still have no community transmission, right? And ever since the cases of the 2 British women, there's only been one case. It's currently 1:30 on Friday, and it will have been announced in the last 20 minutes or so as to whether there's been any more. But certainly there's the 2 British women. There's one other person subsequent to that, which again was due to international travel, and this person was identified while they were in quarantine. So certainly the border issue is really the most significant issue we have to manage, and testing of those coming into the country is critical. And people are going into that managed isolation situation for 14 days and are supposed to be tested on days 3 and 12 during that time. And clearly, as we've seen, there are some gaps in some of these protocols. The latest update that I've seen this morning was that the Army has been brought in to manage the border due to their capabilities around following protocols and following those disciplines. So that's an interesting change that is being proposed to better manage what happens at the border. So those are the questions that came through that we didn't get to the other night. I hope it's provided some further insight into what's going on in New Zealand regarding COVID, and yeah, thanks again for having me, and keep safe.